Hello, friends. I hope you are all safe. In this time when COVID 19 has affected all, one thing that is prevalent everywhere is testing for whether COVID 19 is present or not. And there are different testing methodologies employed around the globe. How do we quantify whether a particular test is good and whether a particular test is bad? Just based on accuracy, it is very bad to quantify a test like that. And which test will be good for screening and which test will be good for diagnosis? So I'll be answering all these questions in this video. So let's get started. Though the contents discussed in this video are applicable to almost all diseases in general, I'm just referring to disease condition as COVID-19, just for simplicity's sake. There are different metrics involved in testing. One and the foremost is the accuracy, which is really common and almost everyone knows about it. I'll be discussing it shortly. Now, two more of the most important and very relevant metrics are the sensitivity and the specificity, and both of them are preferred by medical professionals. Sometimes they are even cited in the newspapers, and you can see these values highly cited in medical journals. There are other metrics like precision, recall, true positive rate, false positive rates, and these are mostly used while developing an algorithm or test by the data scientist or the person who are involved in that developing that particular testing procedure. But in this video, I'm just going to restrict with these three. Before we move further, I would like to discuss some basic terminology involved. So when the test result is positive, that means it's an abnormal case and the patient has contracted the disease or the condition. In our case, it's COVID-19. When the test result is negative, the patient is free from that disease or condition. Now, there are two phases in testing. Usually, the first phase is the screening phase, and the second phase is the diagnosis. The screening phase is usually done at the mass scale, and especially in COVID-19, people are using rapid test kits and to test whether the person is suffering from COVID-19 or not. Diagnosis is a more of a serious study where people tend to take chest x-rays, and the doctor does a deeper investigation of a patient and determines whether this person is suffering from that particular disease, in our case COVID-19, and then further proceeds to treatment. Now, in medical terms, you can usually hear the term gold standard. What gold standard means is the method that has been established which is 100% accurate. We'll come back to this shortly. Now, as I mentioned, why accuracy is a misnomer? Now, accuracy is nothing but the number of correct predictions divided by total number of predictions. On the first side, it seems to be normal, but what is the problem with accuracy? Let's say we have a rare health disease prevalent in a population, but that rare health disease has only affected 0.1% of the population, and that our testing method always returns negative results always. Then accuracy would be nearly 99.9%, but it does a very bad job in identifying this particular disease. So we need better metrics. Few other additional terms are true positive, true negative, false positive, false negative. I'm just discussing these terms so that it would be easy for me to define sensitivity and specificity later. So true positive is nothing but the number of currently identified positive cases. That is, in our case, the patient has COVID-19 and the algorithm or the test has currently identified it. Now, what is a false positive? False positive is incorrectly predicting that a patient has COVID-19, but in reality, he doesn't have that disease. So, false positive incorrectly predicts abnormal or positive cases, but the true value is negative or he is normal. Now, what is true negative? True negative is nothing but when a person is healthy and that algorithm confirms that he is healthy. That is correctly predicting negative or normal cases. Now, what is false negative? So, which is the last part. As you might have guessed, it is nothing but misclassifying a positive case as a negative. That is, misclassifying a person who has COVID-19, but a test or algorithm incorrectly concludes that the patient has tested negative. Now, coming back to sensitivity and specificity, sensitivity is nothing but the number of true positives by the number of true positives and false negatives. So, true positives are nothing but the number of cases where the algorithm has correctly predicted that a person has contracted COVID-19. False negative is a misclassification by the test or the algorithm where the patient is suffering from COVID-19 but the test fails to recognize this. Now, sensitivity reflects the ability of a test to affirm identify positive cases correctly. Sometimes it's also called as recall. Now, sensitivity close to 1, meaning that we have very minimal false negatives. Moving on to specificity. Specificity is the ratio of true negatives by the true negatives and the false positives. True negatives is where the cases have negative and the algorithm has confirmed it. False positive is when the person doesn't have COVID-19 but the test or algorithm claims that he or she has COVID-19. Now, specificity reflects the ability to determine negative cases correctly, and one of the common terms used usually in the medical journal is the false positive rate, which is nothing but 1 minus specificity. So if you subtract specificity from 1, you'll be getting the ratio of false positives divided by true negatives and false positives. Now, specificity very close to 1 means that we have very minimal false positives. Now, coming to the ideal case, that is the gold standard. As I mentioned earlier, gold standard is 100% accurate. So, with the sensitivity and specificity very high, that is equal to 1. Also, we have minimal or 0 false positives and false negatives. That is, we don't have any misclassifications. But in reality, we cannot achieve this gold standard. So we have to set up with a very sweet spot between sensitivity and specificity. Now, a method with high sensitivity will have low false negatives, but it might also result in a higher false positives. A method with a high specificity will definitely have low false positives, but it might lead to a higher false negatives. So we need to find a method where we have a sweet spot between sensitivity and specificity according to our needs. Now, what is the most important method for screening? That is, let's say, rapid test kits. So in screening, the initial phase, the main goal is to minimize false negatives. So the most important goal is not to miss any person who is likely suffering from COVID-19. So the goal is to minimize false negatives. As discussed in the previous slides, we have sensitivity with a higher value will likely result with minimal false negatives. So for screening, sensitivity of a higher value is more desirable. Moving on to diagnosis and treatment, we want to minimize false positives in this case. So, false positive is bad because a person who is not contracted the disease might be taking the treatment. Imagine a patient who has been falsely classified as having a cancer getting a treatment like chemotherapy for cancer. So, during the diagnosis and the treatment phase, the methods with the high specificity, that is minimal false positives, is most desired. Now, what are the downsides of having higher false positives? This might even lead to panic, anxiety, and other psychological efforts. And suppose in the initial stage we have lots of false positives, so the person might be admitted to a hospital, and the hospital cost will be increased, and the person might have suffer from panic, anxiety, and with the COVID-19, many people are suffering from anxiety. So it is very bad to have higher false positives. Coming to the downsides of having higher false negatives, basically delay in treatments. So let's say a patient is having cancer, and that our test or a diagnostic method or screening method has classified the person as normal, or the test result was negative. In this case, the person is carefree, and it's giving a very false assurance to the patient, and as a result, the patient is denied of early treatment, and diseases like cancer, and I strongly think COVID-19 also will be the patient will benefit a lot from early treatment. So having higher false negatives is bad. Sensitivity and specificity look like it covered all the aspects of testing. But are we missing out anything? Prevalence. Let's say the prevalence of COVID-19 in a particular population is very low. In that case, it's likely that the true negatives will be very high, leading to a high specificity. But it doesn't, high specificity is due to the prevalence of this particular disease in a particular population, and not due to the prowess of the testing method or algorithm. So these are some of the factors that dominate the accuracy and the efficiency of a testing method. Thanks for watching. I hope you all stay safe, and also please remember to maintain social distancing, stay clean, and be very happy, and help those in need. Ciao.